A delayed onset nodule is a firm, often painless lump that appears weeks to months after filler treatment. So unlike swelling or bruising, these nodules develop long after the initial healing period. So why do they happen and what causes them? Biofilm formation. This means a build-up of bacteria that can be around the filler. Immune reaction, so the body sees the filler as a foreign substance, a foreign body. Low-grade infection, so bacteria being introduced during or after injection. So the symptoms of a delayed onset nodule are a firm, persistent lump that's under the skin. Sometimes, not always, but you can get some redness or tenderness in the area. Delayed swelling, this can even be months after treatment. So if you do suspect that you've got a delayed onset nodule, what do you do? So first of all, we need to rule out infection. So you need to check for warmth, redness or pain in the area. You may need to consider dissolving with hyaluronidase if necessary, and sometimes it does require a short-term course of steroids or antibiotics. And if none of that works, you need to be referred on to a specialist. So how do we reduce the risk? So firstly, you can choose a high quality, reputable product. So cheaper fillers, they tend to contain impurities that can trigger inflammatory reactions. Always make sure that fillers are CE marked or FDA approved. This will mean that there is a low risk of a delayed immune response. Meticulous aseptic technique. So always clean the skin thoroughly before injecting. Minimise the number of times that you have to re-enter the skin with the same needle, reducing bacterial contamination and transfer, avoiding overfilling and layering correctly. So overfilling increases the risk of biofilm formation, making nodules more likely. So injecting the correct plane of tissue, placing filler too superficially can also lead to lumpy formations over time. Also, be cautious with patients prone to inflammation, so anyone with autoimmune conditions or recent illnesses or even dental procedures can increase the risk of DONS. And finally, educate your patients on post-treatment care. It's really crucial. Things like technique, hygiene and product selection all play a very critical role in preventing complications.